love it. And what I love so much about this job is that it is truly a prevention type job. I feel like I get to make a difference in the lives of children every single day.
Do you ever have so many questions and no one to ask, so they're just wasting away on Google searches you'll forget about in an hour or so?
We had that same problem, and that's why we created the RD2BE podcast, a resource for dietetic and nutrition students looking for answers that their peers don't have.
We are students Macy and Emily and registered dietitian Carl Barnes. We engage in conversations and learn from RDs.
Join us weekly as we gain insight into the unique journeys of registered dietitians all over the country.
Welcome back to the RD2BE podcast. I am Carl Barnes, your registered dietitian host. This week, joining us is someone who I have looked up to for several years. Emily will be interviewing our guest this week. We are joined by Donna Martin. She is a director of school nutrition program. She is a past president of the academy. She has held numerous leadership positions, not just in the Academy of Nutrition and Dietetics, but nationally, and has actually done lots of other stuff. And I'm excited for you to learn a little bit about her and the great stuff she has provided this profession, and hopefully provides some inspiration to all the RD2Bs on their journey. So without further ado.
So where did you get your undergraduate degree and do your dietetic internship?
Well, I was born and raised in Miami, Florida, and I went to the University of Georgia for my undergraduate degree. And in those days, you could only apply to 2 internships. So I applied to Emory in Atlanta and the University of Alabama in Birmingham, Alabama. And I got accepted at both, and I opted to go to the University of Alabama in Birmingham because it provided a stipend. And money was, just like every other student, was tight. And so having, being paid to do it, which nowadays, people have to pay to do internships. But when I was lucky enough that I got a little stipend for that program. And what was great about that program is when I finished the internship, they had some scholarship money to stay on and get your master's degree. So I opted to stay, get my master's degree. And keep in mind, this was back in 1976 when people weren't getting master's degrees. And now everybody has to have a master's degree. And I was engaged, and my fiance, which is now my husband of 43 years, went like, "You're going to stay another year and get your master's?" And I said, "Well, I'm going to be living in Augusta, and there weren't any opportunities in Augusta to get a master's degree." So that was the best decision I ever made in my whole life, Emily, because it has opened more doors for me than anything I have ever done. And you're going to hear about that more as we talk in the interview.
Awesome. So did you have your master's in public health and nutrition? What's your master's in?
My master's is in clinical nutrition.
Okay.
Because, I wanted to be a clinical dietitian like everybody else. I thought that was the path that I wanted. And to be honest, I really rarely worked and didn't do much in clinical nutrition. It's just that I think most dietetic students think they want to do clinical nutrition. And I personally am seeing a trend to people wanting to work much more in community nutrition. And personally, I think that's where it's at, because community nutrition is much more prevention. And that's what I feel strongly about. Whereas I think clinical nutrition is much more the treatment phase. And I think prevention is where it's at.
Awesome. So what made you want to pursue dietetics?
This will be the funniest story, and you will get a laugh out of this story, Emily. So as I said, I was born and raised in Miami, and I lived next door to this family that I babysat for all the time. And she was this gorgeous stewardess, and her husband was this pilot. And I just, as a teenager, just looked up to them. I just thought they were the coolest couple. And I said, when I grow up, I told her I wanted to be a stewardess. And she looked at me, and I happened to be very small for my age at that point. And she said, "Donna, you could never be a stewardess." Well, I immediately thought that was because I wasn't pretty enough and this, that, and the other. But in actual reality, it was because I was too small. And in those days, you had to be tall enough to be able to reach into the cabins and stuff like that. So So she said to me, "You ought to become a dietitian." And I said, "Dietitian?" She said, "Yeah, if you work for the airlines, you can plan menus and you'll get to fly just like you're a stewardess." So I went to college and said, "I want to be a dietitian because I want to work for the airlines and I want to be able to fly all over the world." And so it's funny, I never did work for the airlines, but when I was president of the academy, I did get to do a lot of traveling all over the world. So I said, becoming a dietitian, my dreams did kind of come true. That I got to fly to Mexico, went to Mexico, and I got to go to Europe and Spain and some different places. And I think I got to visit like 25 states speaking as, in my travels as president of the academy. So being a dietitian did allow me to get to travel a lot. So I think that's a hilarious story about why I became a dietitian.
Yeah, that's crazy that like one person had such like a big impact on you.
And I find when I talk to a lot of interns that I ask them why, and they'll say, I was going to be a nurse or a physical therapist or something, and I took a nutrition class and I fell in love with the professor and just piqued my interest. So you just never know what kind of influence you have. And I work with a lot of high school students here in my job, and I try and encourage them to think about the field of dietetics, and you just never know when you're gonna have that influence, and that one person totally influenced. I'd love to have gone back and thanked her for telling me I couldn't be a stewardess.
So when I was like looking to try to find people for the interview, I saw your LinkedIn profile and I was like intrigued. So from what I'm seeing, that your first job was an internship director.
And it wasn't actually.
Oh,
So
okay.
yeah, so I guess I should have put my first job before that. So, and that's what goes back to what my master's did in terms of opening doors for me. So when I finally graduated, I had a master's degree and I moved to Augusta and I got married and I started looking for jobs. So I immediately started looking in hospitals because I thought I had a master's degree in clinical nutrition. That's what I wanted to do. And there were 1 million jobs open in Augusta. And so I went around and interviewed at all of them. And actually one of them required a master's degree, and it was working in the children and youth. It was like a clinic. It was more of a community nutrition job. So I got to do WIC and got to do a lot of different things. And what was interesting about that job, Emily, is that I did not have pediatric rotations in my internship. And yet I said it was the job that paid the best, and it didn't have to work weekends. I didn't have to work holidays. And that's what I've loved about community nutrition, is that, you don't have to do weekends and holidays and things like that. So my first job was at the Children and Youth Clinic. And like I said, I did not have a rotation in pediatrics. So I just had to fly by the seat of my pants. But what I would encourage and like to talk to other students about is don't ever be afraid to reach and try a job that you don't think that you can totally do, because every single job I have ever had, I never felt qualified to do. So I did 2 years at the Children Youth Clinic, and I got a call one day, and it was from the director at University Hospital, and she said, "I'd like you to come interview for this job to be the internship director. We don't have an internship here in Augusta, and we have job openings like crazy, and we need dietitians. And so I would like to start an internship." And I went, I'm only 2 years out of my internship. I don't know anything about starting an internship. And she said, "Well, you're the only person in Augusta with a master's degree, and we have to have somebody with a master's degree." So my first job at the Children Youth Clinic, you had to have a master's degree. That's the reason I got that job. My first job as an internship director, you had to have a master's degree. And my job now as a school nutrition director, you had to have a master's degree. So that one decision in my life to wait a year, wait on getting married, has so impacted so much of what I did. And so again, I didn't know anything about being an internship director, but I jumped in, and loved that job. I loved working with students. I loved
Mhm.
mentoring students. I loved it, felt like I was really good at inspiring them. And the only reason I left that job and went to school nutrition is I had two small children, and they were wanting to do, ballet and dance and
Mhm.
baseball and all these after school activities. And I felt like I was really confined in the hospital. And Christmas and summers, I was, trying to find what I was going to do with my kids. And I thought, well, if I worked in school nutrition, I would have the
Mhm.
holidays off and be on a more of a school schedule like my kids.
Yeah.
So I applied for the school nutrition job. And I'll tell you a funny story about that job too, is that I didn't know anything about school nutrition. In my internship, we didn't have a school nutrition rotation, but as an internship director, we had a school nutrition rotation. So I had called the person who was in charge of that rotation and said, if there's ever any openings in school nutrition, would you give me a call?
Mhm.
So she called and said the director was retiring after 33 years. And she said, I will wind up being, she'd been there like 8 or 9 years. And she said, I expect to get the director position, but they typically in school nutrition jobs, they hire from within. They usually hire like a home ec teacher or somebody like that. And she said they rarely hire outside the system. So she said, why don't you come interview for the director's job? And then when I get the job, you can come back and interview for my job, and you will have two opportunities to be before the committee and hopefully get the job. So I said, okay. So I called a bunch of my friends that worked in school nutrition around the state and said, guys, I don't know anything about school nutrition, but
Mhm.
give me some advice for my interviews. So they told me what was happening in school nutrition. So I went in there and I did my interview, and I got the call that night, and I got the director's job. So I was like, what do you say when you don't really want the director's job? It was kind of like when they called
Wow.
me for the internship job, an internship director job, and the school nutrition director's job. So I took it, and the person who wanted the job quit immediately because she was so upset they didn't give it to her. But you know what happened, and this is some really good advice I'll give y'all, is they asked me in the interview what would I do to improve the school nutrition program. And so I had networked with a bunch of people, and I knew exactly what the trends were in school nutrition. And I came up with all these really creative ideas that I got from all my friends who worked in school nutrition. And when they asked the person who was there for 8 years what she would do to improve the program, she said, nothing, the program is fine. So they said, we're not going to go with somebody that thinks the program is fine. We're going to go with this person who has all these creative ideas that I
Yeah.
stole from all my friends. So the power of networking is
Mhm.
important. And in my career, that's something I have done, and that's something I've tried to give back. And that's one reason I'm so happy to be doing this podcast with you, is trying to share with future RDs what really
Mhm.
worked for me in my career.
That's awesome. So now that you are a school nutrition director, so how satisfied do you feel with your job, and like what are your job roles?
Oh, it is, honestly, Emily, I would say every job I was ever in, I loved. And I would have never left my pediatric job if they hadn't called me from the internship. And I loved my internship job, and I probably would have never left that had I not felt like I needed some more time to spend with my children.
Mhm.
And so I've been in school nutrition for like 30 years now, and I love it. And what I love so much about this job is that it is truly a prevention type job. I feel like I get to make a difference in the lives of children every single day. And I'll share this story with you. My son, who is an attorney, who I'm so proud is an attorney, said to me one day, he said, Mom, you get to do something in your job that makes a difference in the lives of people every single day. And
Mhm.
I feel like I get to do that. So he actually went out and started doing some pro bono work, so that he
Oh
said,
wow.
in 30 years, I don't want to look back and feel like I didn't make a difference in somebody's lives. So
Mhm.
now this pro bono work that he's doing, he says he really feels that sense of satisfaction. So I guess that's the first thing that I love about the job. The second thing I love, Emily, is that every single day is different. I mean, no 2 days are alike. So every day I come in thinking this is what I'm going to be doing today, and every single day all kinds of things come up. And so, I think one of the biggest things I do is I like to say I'm the chief problem solver. Every single day, I am either putting out fires or solving problems. I got a call last night, one of my employees, her mother's in the hospital and she couldn't come to work, and she's the secretary at one of the schools and the cashier. So I had to figure out who I could pull and who I could find to cover for her. So every single day is different. And I feel like this job uses every single skill and every single course that I took in undergraduate. And so
Oh,
for
wow.
those of you in undergraduate, you're kind of going, why do I have to learn about menu planning? I'm never going to plan menus. Guess what? I plan menus all the time. And you're going to say, why do I have to learn about standardizing a recipe? Why do I have to learn about how to make biscuits or whatever? I have to standardize recipes. I have to work with computers every single day. So I look at buying computer software programs for all my cashiers, and I have to teach Excel to my secretary. So I have to know all about all the different computer things. I have to do budgets. I have a $5 million budget. So why do you need accounting? You need accounting. You need to know about budgets, and I utilize that skill. I write specifications. I buy equipment. I buy, right now I'm getting ready to buy 2 double stack convection ovens, and I have to write specifications and bid them out. And those are $20,000 pieces of equipment.
Wow.
I hire employees. I coach employees. I fire employees. I discipline employees. I work with social media. I have a Facebook account, I have an Instagram account, and I'm always trying to promote school nutrition with my parents, with my students. So I work in social media. I do nutrition education all the time. I'm trying to do nutrition education with my students that are in the classroom. I'm trying to do it with my teachers to make them be healthier. I think I do in-service education with my staff. I'm always trying to teach them how to do better at safety and sanitation. I have to know HACCP, HACCP things. So I'm always working with, I'm scared to death that my children would get sick that I feed. I work with special diets. So I do some clinical stuff. I have lots of kids that are diabetics. I've had some low-fat diets. I've had renal failure diets. I have a lot of allergy diets that I deal with. I have kids on tube feedings that I deal with. I have to write policies and procedures and handbooks. I have to do disaster planning because I have hurricanes that come in. What do I do when my power goes out? I work with wellness programs. So I don't think you could name a course or class that you took or are taking or have to take that I don't use in my job. So I just love that every single day is different, and that I get to do a lot of prevention stuff. And I told somebody I feel like I wear a fireman's hat because I'm always trying to put out fires, like March 17th when COVID hit and we shut down all the schools. How was I going to feed my kids? I have a very food insecure population, a very vulnerable population. And I had to figure out how I was going to make sure these 4,300 kids that I'm in charge of got fed. So we immediately got buses, put food on buses, and delivered food to the kids every single day. So how do you flip that? And then, we're feeding in school one week, and then the next week where the kids are all out of school because we've had so much COVID, and we've got to figure out how we're going to get the food back to them, where we've got food in our kitchens that was going to be hot food that we're doing in the classrooms or doing during the school day, and then we've got to send food home, and it's a total different, I call it the judo flip. You just flip. So I kind of feel like that's why I say I kind of wear a fireman's hat, and my dad was a fireman, so I guess I like that analogy. But I do feel like I'm constantly putting out fires. But I've been working 43 years in dietetics, and I feel like I learn something new every single day. There's always challenges. It never gets gets old. This job never gets old. And
Mm-hmm.
the opportunity to be creative with my menus and so what we're doing is these really cool weekly food boxes. So I have 1,000 kids that are virtual that never come to school. So
Okay.
every Friday they pick up this box from me, and in it is like this big surprise. And I
Mm-hmm.
put asparagus in it and mangoes and avocados, and I give them all this information about what to do, how to cut a fresh pineapple, how to make guacamole. I do recipes in there. So I'm doing this awesome nutrition education.
Great.
I call ourselves the Blue Apron of Burke County, where I'm really teaching them. And so it's just always something new and something different. And I get to be so creative when they say, oh, we've got all this extra diced chicken, Donna. What are you going to do with it? Well, let's teach them to make chicken casseroles.
Mm-hmm.
We have all this extra cheese. So this week, the kids are getting grilled cheese sandwiches for lunch in their boxes. So
Mm-hmm.
it just, I'm always challenged in this job, and I love it. I
Mm-hmm.
love it.
Are you teaching in a public school system or a private school system?
The public school system.
Okay.
It's a public school system, but dietitians do work in private school systems. Private school systems are not as apt to offer the National School Lunch Program. A lot of times they cater. They offer Chick-fil-A one day and Pizza Hut the next day.
Yeah, I went to a public school and then I went to a private, and the private did cater.
Yeah. So I'm always pushing to get dietitians because the private schools need it as badly as my public schools do.
Mm-hmm. Yeah. So when you were an undergrad or when you were an intern, I know you said you wanted to do clinical, but like what were your career goals as a clinical dietitian?
Emily, I hate to say, I really didn't have any career goals at that stage. And I'm embarrassed to say that. I grew up, I was the first child in my family to graduate from college. So I was a first generation college graduate.
Mm-hmm.
And came from a relatively, I didn't realize that we were low on the socioeconomic ring. I guess we never went hungry. But I'll tell you a funny story. I was in college and I went to Crystal one night really, really late, and I went and got some chili. And I sat down and went back up to the lady and I said, you forgot to put the rice in my chili. And she said, rice in your chili? I said, yeah. I said, where's the rice for my chili? And she said, ma'am, we don't do rice in the chili. So I called my mom the next day. I said, Mom, why did we always eat rice with our chili? She said, well, we couldn't afford the meat. So I had the rice to stretch the meat. And that was probably one of the first times I realized all the things my mother did over the years, and having a home cooked meal and stretching food and stretching budgets. And it was some really good lessons for me to learn. So my career goal was to get a job. And my mother always said she wanted me to go to college, that if I married a guy that couldn't support me and something happened to him, I could support myself. So that was my goal, was just to get a job to be able to support myself. So I'm embarrassed to say I did not have a lot of goals. And so that's why, I just felt so fortunate that I got my master's degree, that it opened so many doors for me.
So when talking about you as a community dietitian, I know you said you don't really have any career goals, but how like your career path, like you think, changed over time?
Well, I think it changed from, I guess, having to get more education and constantly learning about new areas and new subjects, and realizing that I feel like what's great about a dietetic internship and completing a dietetic internship is the skill sets that you have. I guess I've kind of learned transfer into any job that you want to take. I learned from all these different jobs I had that I never felt qualified for, that whatever I decided I wanted to do or was interested in doing, that I could learn it and I could do it and I could be successful at it. And that's what I try and encourage students and other dietitians to do, is to not be afraid to branch out and try other things that interest you, even though you maybe don't feel like you're that much of an expert in them, that especially with Google nowadays, you can Google anything and learn how to do anything. So I think my career changed, and I got realized that the sky was the limit in what you could do. I think I started out with my goals, just I want to be a clinical dietitian in the hospital, and I never dreamed, that I wanted to be the department head and that I wanted to
Mm-hmm.
be the director. And as time went on, I realized I could take on those roles, and I had some leadership capabilities, and that my skill sets, that I could stretch myself. I guess I did not have a lot of confidence. And as time went on, I built more confidence. And as I was successful at every job I had that I'd never felt qualified for, I kept saying, okay, I can do this. So it really, I think that's the key lesson that I learned.
Great. So I know you talked a little bit about what you do on a day-to-day basis, but what skills do you think people would need to complete those tasks? Like, you sound very well-rounded.
Yes,
Hone
yes.
in on a few. What do you think they would
Well,
be?
some of the skills I think that I didn't develop in my internship is
Mhm.
that I think you really need public policy and advocacy skills.
Okay.
And that's something that I feel like, especially when you work in community nutrition, although I feel like every dietitian needs to know about public policy and advocacy skills, because those skills impact everything. So like if you're a clinical dietitian, they impact whether or not you get medical reimbursement. And we
Mhm.
need more medical reimbursement. But in community dietetics, for me, it impacts the money that we get and what programs are offered. And I don't know how much you know about school nutrition, but there's paid, free, and reduced meals, and we're trying to
Mhm.
get universal meals so that all kids eat free, because technically school books are free, busing is free, teachers are free, computers are free. Why is the lunch program not free to every kid? So, but having public policy skills, I think, are really, really huge. So you need, for WIC, you need that, and food stamps, and
Mhm.
having public policy skills and getting involved. So I know my congressman very, very well. I've gotten to testify before Congress. That's how I made it to the White House. Michelle Obama came down to my district
Wow.
and helped plant in our gardens. And twice I went to the White House to got to speak about school nutrition issues, and to speak as a registered dietitian and things like that. So I
Mhm.
think public policy skills are huge. I also think marketing skills are huge. That's another thing that I really wasn't trained on in my internship. So I feel like I'm constantly having to market my program, market it to
Mhm.
the students, market it to the parents, market it to the teachers, and then market it to the whole country. I mean, people have a really bad opinion of school lunch and think we serve pizza and French fries every day.
Yeah.
We do not. I mean, my lunch yesterday was Congo chicken, collard greens, and carrot souffle, and I mean fresh apples. I mean, we offer amazing food, have amazing farm to school programs and things like that.
Mhm.
So I think knowing how to market. I also think more agricultural skills. So I didn't know anything about ag, and so I'm having to learn. We have a huge farm to school program here, so I'm having to learn all about farming, sustainable agriculture, all about milk and dairy. And so I think those skills are really big. I also think managing employees, that's something I didn't get in my internship. I have 60 employees that report
Wow.
to me, and day in, day out, I have some, just fantastic employees that don't need any kind of managing. I mean, they would just do a great job all on their own. And then I have
Mhm.
employees that they're just here to back up and get a paycheck. So how do I motivate them? How do I train them? How do I want them to see this as more than just a job? So I think
Yeah.
that is a huge thing. Grant writing. I didn't learn anything about grant writing. So, I'm forever writing grants because we're always struggling to get more equipment in school nutrition, or I wanted these catering trucks and just different things. So grant writing, I think, is something that is some skill sets that I think I didn't get in my internship that I think are huge things that maybe are different than what I thought I might need to know. But I think also just flexibility and willingness to try. And I always talk about the critical thinking. I think critical thinking skills are huge because I have made some major mistakes thinking that, oh, this sounds like such an easy thing to do. And it's what I call the pebble in the pond. I think, let's start breakfast in the classroom. It's no big deal. You know, all we have to do is get the food down to the classroom. Well, I never thought about the fact that when you individually wrap all these things, they take up more space, so we need more freezer space. And then how do we keep the food hot, and how do we keep it cold? And so I call it the pebble in the pond. It sounds like just a really, really simple thing to do, but there's just layer after layer after layer. And so having those critical thinking skills and being able to think through those things, I think, are really huge. And I think that internships are doing a much better job of trying to teach critical thinking skills, because you can't always go to a notebook. Everything is not 1 + 1 = 2.
Yeah.
There's always so many things. So you have to have contingencies, and you have to be willing to fail too. It is okay to fail. I have done some things that didn't work out. Like, we jumped on the bandwagon. I'll give you a perfect example. We jumped on the bandwagon of the kids when they'd come through the line. We had trouble with them remembering their 4-digit numbers. And so we said that with some new technology, they could put their fingerprint on a fingerprint pad and it would register them. And I thought, this is great. We won't have kids coming through borrowing people's numbers and this, that, and the other. Well, we didn't count on the fact that the kids would have peanut butter and jelly on their fingers, and that they'd have snot on their fingers, and all these different things. It didn't work. So we invested all this money in this technology because it was brand new, and I was all about trying something new and different, and it didn't work. And it was okay. I failed. I'm willing to admit it. So 5 years down the road, that technology may be available and may be workable, but it didn't work for us. And then the parents called and said, are you fingerprinting our kids, and are you turning this into the FBI? It was all kinds of stuff. So it's okay to fail, and I'm okay with admitting that. And the other advice I would give is that when you're hiring people, hire the best and the brightest. A lot of people don't want anybody smarter than them. I want to hire people smarter than me because they make me look good. I'm very secure in my job as the director, and I try and hire the best and the brightest.
That's awesome. So how do you feel that your skills that you mentioned differ or compare to clinical dietitians?
So I think, clinical dietitians have to be much better experienced in motivational interviewing. And I think as a clinical dietitian, one of the things you really have to, when you walk in, whether you're an outpatient or, whether you're an inpatient, and you walk into a patient's room or a patient comes to see you, you need to be really good at motivational interviewing, because if you're going to get them to do what you want them to do, that it's a struggle. So I think I don't have to deal too much with that. So I think motivational interviewing skills are key there. Also, the nutrition care process. I think, I don't deal that much with the nutrition care process. I think when you're a clinical dietitian, you need to be really, really skilled in that. And I think, knowing much more about lab values and TPN and enteral nutrition and medical nutrition therapy and things like that. Most of the medical nutrition therapy I do is on a very basic level. If I went in the hospital right now, I could not do a TPN order, and I would have to get Google out to double check creatinine levels and BUN levels and all those kinds of things. I learned those, and I really don't know them anymore. So I think some of those skill sets are a little bit different. You're much more on the treatment side instead of the prevention side. So I think the skill sets, but in general, I really I know I sound like a broken record, but I think so much the skill sets that you learn
Mm-hmm.
can translate into any job that you take. And that was something that was really hard for me to learn, that you can go from job to job. And I think clinical dietitians, I've seen dietitians become heads of many departments. And in school nutrition, I've seen school nutrition directors that are registered dietitians not go from being director of school nutrition to being like an assistant superintendent, where they're over maintenance and transportation and the custodians and
Mm-hmm.
because their skill sets are so good, our training is so good that they're able to really rise up. And I've seen
Mm-hmm.
dietitians in the hospital go from being department chairs to being over the emergency room and other departments because of our skill sets.
Awesome. So for your job, I'm sure that you've like come in contact with like a lot of different people and like different areas. So do you think did you receive cultural competence training?
I didn't when I was an intern, but I have received some since. And I'll tell you, Emily, I have to continue to work on my cultural competence.
Mm-hmm.
It is not easy. I have to constantly be aware of what my cultural background is, what are my values, what my beliefs are, and make sure that I'm not putting those on to the families that
Mm-hmm.
I work with. I have to constantly watch my attitude and belief system. And I'll give you a perfect example. Like, I personally value eating healthy, and I personally value the opportunity to exercise, and
Mm-hmm.
I personally value um, being at a healthy weight. The
Yeah.
clientele that I work with do not value eating healthy. They
Mm-hmm.
do not value exercise. Most of my students do not value a healthy weight. I've had employees that wanted to gain weight. They wanted to be overweight. That's what they valued. So I've always had to check my values and beliefs at the
Mm-hmm.
door and not impart them on anybody else. So I am constantly working on my cultural competency, and I don't think I think that's a really hard thing. I think what's different in clinical and community is that in community you have the opportunity to develop relationships with your students or your
Mm-hmm.
employees, or your if you're in WIC, with your patients, whereas when you're in the clinical setting, you don't have the opportunity to develop those long-term relationships. And I think in order to gain the trust of your client, so that you could um, encourage them to value healthy eating and value exercise and value some of the things that I value, you have to develop those relationships.
Mm-hmm.
So I think that's the advantage of working in community nutrition, is that you have that opportunity to develop relationships and develop that trust. So,
Mm-hmm.
but I do think it's, very, I've struggled with, we did a survey of what we needed to do to change our menus, and we got things back like we needed to do neck bones and rice, put that on the menu. And I didn't even really know what neck bones and rice was. So I had to go out and survey and look at that. So, um, you know, cultural competency is a hard thing. And until you understand that you cannot put your values and beliefs on other people, that you've got to accept people from where they come from and what their upbringing is and what they value.
Mm-hmm.
You've got to, it's hard. I'll tell you, it's hard. And so I'm constantly working on it. And but I've had some training, and I probably can use more training. But I think in internships, they're doing a much better job with that. And I think that, just nationally, there's much more emphasis on all of that. And so I think people
Mm-hmm.
are paying much more attention to it. I didn't even know what it was when I was an intern, I can tell you that. But so I've learned a lot, and I've learned to value where people are coming from, and I think I'm doing a much better job in that area.
Mm-hmm. So, do you feel like you need to keep up and know about the programs that are outside of your specialty area, or do you think that you should like hone in on school nutrition and stuff like that and really keep that focus?
Well, I guess I have done more keeping up with my area because I feel like
Mm-hmm.
there's so much to learn. I mean, it is challenging and it's
Mm-hmm.
constantly changing. And so I guess as long as I feel challenged and I don't get bored in it, I'm fairly comfortable with that. But I still go to state meetings and I go to national meetings and I go sit in on other topics and other
Mm-hmm.
areas. And I get really interested in learning about what other people are doing and learning about the gut biome and all these other areas. So I learn enough to know that I'm not an expert in those areas and that there's a lot going on. And so when my friends ask me about those areas, I don't always feel comfortable. And so I will send them to somebody who is an expert in those areas.
Mm-hmm.
Like sports dietitian, sports nutrition, I am not an expert in that area. And the
Mm-hmm.
football team wanted some help in that. And so I reached out to somebody that had expertise in that area.
Mm-hmm.
So, I mean, I can read up on it and I can learn some, but I think that most people are specializing more. But I think you can specialize in something, but I do feel like you can then switch to another area and learn and specialize in that. I don't think just because you're a sports dietitian, you have to be a sports dietitian your whole life, or because you're a school nutrition, you have to be there your whole life. But I do feel like there's so much to learn in school nutrition that I do concentrate a lot of my education and interest when I go to meetings in those areas. But I do really still like to learn about other areas. I'm fascinated about what other people are doing in other areas.
Mm-hmm.
But I don't spend a lot of time on those other areas.
Yeah, I mean, I'm sure school nutrition has crazy new things coming out every day, like try to enhance health.
Well, and I think just, and I spend a lot of time working with public policy,
Mhm.
and I spend a lot of time doing a lot of lecturing,
Mhm.
and for people for dietetic classes, just like what I'm doing here. So I spend a lot of time trying to teach school nutrition to other people because a lot of people don't get it in their internship. And
Mhm.
I'm always trying to encourage dietitians to go into school nutrition because I think if we had more dietitians in school nutrition, we could totally change the trajectory of the future populations. If we could teach kids to eat right, then we wouldn't need as many clinical dietitians in the hospital working with these people who
Mhm.
never learned how to eat healthy.
Yeah.
So I feel like this is just, and when I have interns that come rotate with me, 99% of them want to go in school nutrition when they leave. They just love it and they see all the variety of things that I get to do, and they get really, really excited about it. So it's a it's just a fun area.
That's
But
great.
I get to do other things too, so it's enough to kind of keep me going. And just with public policy, learning about public policy is fascinating. I've really been so tuned into learning about, how when you go and talk to a Republican or you go and talk to a Democrat, how you have to change your messages and things like that. So there's a lot of skills there that I'm still learning and growing.
Mhm. So, what programs are you involved outside of your school nutrition at a community level?
So this is a really cool thing. So, I've been so active because I was active as a delegate and active in my practice group and volunteering. And then I was treasurer of the academy, and then I was president of the academy. It took a lot of my volunteer time. So when I finished doing all that, I have since joined the American Heart Association
Okay.
board, local board. And that's been a great experience for me because they are really working with food insecurity, and they're not just working on stroke prevention and high blood pressure and heart disease and stuff like that. They see the value of prevention, and they
Mhm.
see the value in schools of trying to get as many programs in schools so that we can make sure our kids eat a healthy meal. So I've been working with them and doing some stuff on the national level with them, and it's really been fun. I've been able to share what I do with another avenue to share what I do as a dietitian, and it's given me the opportunity to work with other school systems in the area, because we offer breakfast, lunch, after school snacks, supper, summer feeding. We just do all this programming, and a lot of school districts don't. And so the American Heart Association is trying to get more school districts to do supper and summer feeding and some of the programming that we do. So it's given me the opportunity to talk with other school nutrition directors in other states and other parts of the country, trying to get them to deal with this food insecurity issue and make sure, because just like we talked about the private schools and the public schools, I feel like the kids that have the opportunity to eat the healthy food that we're giving them is going to prevent the food insecurity. And I feel like it's not enough if you're hungry to be fed. You've got to be fed good food. And that's what I'm all about, teaching people that it's not just. So I talk about that a lot, about the food insecurity issue, is that they said, well, the kids aren't really hungry, are they? I said, they may not be hungry, but what they're eating is not going to nourish their minds, is not going to enable them to be successful in the classroom. So the American Heart Association has enabled me to get that message out. So I've done a lot of volunteering in that area. I still work with the food bank and other, I work with the extension agency here in town. I work with a lot of farmers. I have a huge farm to school program, and so I work a lot with our farmers, trying to teaching them and helping them get into school systems. And so they know how to grow the food, but they don't know how to package it, cut it, package it, invoice it, and get it into schools and stuff like that. So I did a lot of work in that area. So I'm definitely branching out after my volunteering days.
So I know you have your master's. Would you ever seek further education?
I did. I went and got an education specialist degree. And so when I took a job in the school system, I felt like I needed to learn a little bit about what the teachers knew and know, and how they teach, and the policies and the issues that relate to the school system, because I was much more hospital based, and I understood that ecosystem and how the policies and the politics work in the hospital, but I didn't understand schools. How are they funded, and this and this. So I went and got I got a degree that was like halfway to my doctorate degree, and I actually did start working on my doctorate. And then I got involved in the academy, and I kind of had to decide whether I was going to continue my volunteer work with the academy and finish my doctorate. So I did not finish my doctorate. So that's probably my one regret I have in life, Emily, is that I didn't finish my doctorate. But getting to be president of the academy was very rewarding, and I wouldn't change that for anything. So it was kind of which do I want to do, and I opted to do that. But I got an education specialist degree. I also got some certifications in school nutrition. So I also worked a lot with the child and adolescent weight management program. So I got that certificate, and I did a lot of teaching in that, trying to teach people about the role that school nutrition can play in childhood obesity and prevention. So I definitely went back and got more education.
Awesome, great. Well, that answered all my questions. I really appreciate it. Yeah, thank you so much for taking time out to talk to me today. I really appreciate it.
Well, thank you so much. It's been a pleasure.
Thank you.